I request Shri Tanzin Choswell to welcome the distinguished doctors with the traditional khadas.
Welcome to Ladakh. Thank you, sir. I hope you have played. Yeah, thank you, sir.
Kotana, sal. Amo. Hatak sagatin. Oh.
Welcome to you. It's a pleasure to be back. Welcome to Ladakh, ma'am.
After 5 minutes.
तो हमारे मुटुब जी और जितने भी इनके साथी हैं जो अशोका मिशन से जुड़े हुए हैं, उनका भी बहुत शुक्रगुजार हूँ कि इतने साल जो 90s में जो सिलसिला हुआ एक काफ़ी डेलीगेशन ऑफ डॉक्टर्स से वो चलता आ रहा है. सो आई एम वेरी थैंकफुल टू द अशोका मिशन एंड इन कोलैबोरेशन विद AIIMS. We have been conducting this super speciality camp for so many years. So in this, the main contribution of this camp, I think, are the doctors itself, and plus our Lama ji, who is Lama Lobzang ji, who has been contributing for so many years. So I would not like to add many points, but would like to highlight 2-3 issues that I would like to put forward here on this August gathering. First of all, I would like to say that people of Ladakh are very thankful in general that whenever most of the doctors in Leh, they inform that super specialty doctors from AIIMS are arriving at this date, and they eagerly wait for the time duration where they'll get the treatment. So I think that this has been a boon for Ladakh in general, especially people who are not able to go outside of Ladakh, especially the poor and the marginal families also. So in coming times, I think we are also setting up a medical college here, so that will take time, but overall our health infrastructure is improving day by day. And I would also like to thank our Director Health Ka Mutuble and Chief Medical Officer Madam Nurzil Le and BMO Le, Ma'am Chorole, and all the doctors that are here. And I hope that within this short period of time from 25 to 29th, we'll be able to complete all the necessary procedures and operations that will be due in Ladakh. And without much further ado, I would once again like to welcome all the doctors here, and I hope that you have a great stay, and in future also we collaborate in a better way and coming up with more operations and more collaborations. And one thing I would also like to add is, as all of you are very much aware of, is Ashoka Mission along with LSDC lay and all the patients that in general public are very much aware of the increasing number of cancers that are here in lay. So I would also like to highlight that point also, that cancers here is increasing every year, and we also asked the doctors what is the exact cause, but exact cause is not able to be detected, I think. But I request, because all of the eminent doctors are here from AIIMS, and they'll be visiting other places also for conferences and other issues. I would like to highlight this very important point, that cancer here is an issue. With a population of 2.75 lakhs in Ladakh, which is Leh and Kargil total population, that cancer rate in stomach cancer and other cancers is increasing day by day. So I request that if we can come up with after this what you call camp of from 25 to 26, if we can sit together and along with our director and secretary also, I would like to request that if we can chalk out a plan for a future where we can detect it by going to far off places and forming like precautionary measure and preliminary preventive steps if we can take, that would be very helpful, I think. So once again, this is the only request that I would like to request is, because you also need to see that Ladakh here is very severe weather, and lifestyle is also changing very fast. So taking that into account, I think we need to do a deeper study, especially for cancers. So once again, I would like to request through all the doctors that if we can form a panel and if we can come up with a strategy to tackle this issue, that will be very, very helpful for the common people.
People from Ladakh who are here today, and what been done for last so many years by Ashoka Mission in direction to improve the health situation of this region of the country. I think it's been a great contribution, but as told, we have to work in a larger manner to look into all the aspects of health. जैसा हम जानते हैं कि हेल्थ जो है ट्रीटमेंट ही हेल्थ नहीं है, हेल्थ जो है एक समस्या है जिसको एक पूरी तरह से टैकल करना पड़ेगा. तो हमें देखना पड़ेगा कि कौन कौन सी बीमारियां हैं, उस बीमारी के कारण क्या है, और उनके जो है कैसे रोकथाम करनी पड़ सकती है. Prevention is a major aspect of a healthcare nowadays. As rightly said, we need to work on that area for prevention of a disease occurring in a particular area, community, society of our country. And Ladakh being in such a difficult terrain of our country, the disorders, diseases, and the major causes are totally different from other parts of the entire country of India. In that way, I think, as rightly told, we need to build up something where we can do a research to look into various aspects of common disorders. As rightly pointed out, not only Ladakh, in entire Himalayan belt, the GI or stomach cancer are one of the major reasons for death nowadays. Every year we get to see so many patients coming with stomach cancers or GI tract related cancers in Delhi, because that's a major center who can treat such a serious disorders. If I see my own journey in this field, the last 45 years in being in AIIMS, I used to see one patient of cancer from my area. I belong to Uttarakhand. One patient of cancer in 1 or 2 years in those days. Today I see at least 50 to 100 patients of cancer coming from my own region. So that shows how much the cancer problem has increased in our country, and mainly in this part of our country where things are totally different. It's maybe because of lifestyle change, maybe because genetically the people living in a Himalayan belts may be predisposed to a GI type of cancer. because of various reasons which we have to work on that. I know Dr. Anup Saraya, who's been coming here for so many years. He's head of gastroenterology in AIIMS, and he's working in this area for so many years, doing an endoscopy for various people, serial for so many last 10 years or more. That might give us some idea of what is the actual feature, anatomical feature of entire area, GI tract, and which particular thing may be causing more cancer in our patients. Apart from that, I think AIIMS being a major premier institute of country, we have a responsibility not only for AIIMS in Delhi, for the entire country, to look after all the aspects of health, that is patient care, research and teaching. Today we have very senior people here. In that way, I think we are very fortunate to serve this part of the country once in a year or twice in a year. Not only Leh, the various parts of Ladakh also. The team has been to Janskar, team has been to Kargil, in the various places also, and our Asoka mission has done very well. So I'm pretty sure that senior people like Dr. Shiv Chaudhary, who is heading the CTVS surgery in AIIMS, will have a real input for our local people here. Dr. Rajesh Kalgawat, he is one of the major administrative areas looking after AIIMS. He can be a good help for discussing various aspects of making some collaborative work, and Rajesh can really help in that directions. I'm pretty sure the team here, Dr. Achil here, Dr. Uma, they have been coming for us so many years. I've seen them for the last 10 years coming here. And Dr. Atul is one of the major person handling the cancer department. I think he is one person who will be very handy to look after that area also. And he's been to all the parts of Ladakh. He knows everybody there. And people coming from Ladakh to Delhi, and we all are always there to support that team. Dr. Manmohan, he's a neurosurgeon. And I think one of the most difficult time is when somebody suffers from neurosurgery disease. And he's going to be a real help in that direction. I remember previously coming to Ladakh and doing screening type of eye camps, helping people for various eye diseases. Then we started doing eye surgery in this area. And that's been a good approach from both sides. We are, thanks to SNM hospital giving us that access for a hospital. Now we have an army hospital giving us their operation theatre area for surgeries. So this type of collective approach will give us a better way of thinking for future area also. I'm pretty sure once the medical college comes up in this area, the health services will definitely improve. And the collaboration between the AIIMS New Delhi and this place will be in a much wider way. I wish all the best to entire Ladakh, being a union territory now, and the people who are working through various NGOs to support the government here. And one of them is Asoka Mission, mainly because of Lama Lobjangji, whom I have known for many years. Before coming to Ladakh also, he was in Delhi. He's been to my place also. And luckily I had opportunity to operate his eyes also. That's why the relationship became much stronger. So I hope that AIIMS and the AIIMS team which is here definitely going to help people of Ladakh, not only for treating, but giving a psychological support to the people of Ladakh also. Thank you for hosting us, and thank you again.
साल इतना बड़ा एक मेगा पिछले साल की तरह एक मेगा मेडिकल कैंप यहाँ पर हम लोग आयोजित कर रहे हैं, तो इसमें बहुत सारे हाईलाइट हैं, लेकिन सबसे बड़ा इस साल का हाईलाइट इसलिए है कि इतने बड़े तादाद में इतने बड़े डॉक्टर्स हेडेड बाय डॉक्टर टीटीआल 5 लोगों का टीम यहाँ पर सिर्फ आई का आए हैं, और दिल्ली से उन्होंने कम से कम 300-400 लेंसेज लाए हैं और मेडिसिन लाए हैं। एक अप्रॉक्सीमेटली हमने उनसे कलेक्ट किया था दिल्ली में 100 kgs के करीब। सो इस साल हमें उम्मीद है कि डॉक्टर साहब भी कह रहे थे कि कोई 100 के करीब कैटरेक्ट एंड सर्जरीज होंगे आई का। तो सब बड़ी खुशी की बात है कि जितने भी बैकलॉग्स रहे होंगे पिछले 2 साल का पेंडेमिक में, वो सब पूरा करने जा रहा है। तो मैं डॉक्टर साहब का शुक्रगुजार हूँ। थैंक यू वेरी मच फॉर कमिंग हियर विद योर टीम। विश यू ऑल द बेस्ट सर। थैंक यू वेरी मच। थैंक यू सर।
Kan itu tuh, yo deh. 4 नंबर है ना यार। दिमागी कॉल कर कोई टिकट मैडम ना यार। ये का कौन से तो 20 तक है वो तो का स्टार्ट करना। और 4 नंबर का कौन
अंदर लिया आपने फुटेज
लास्ट टेस्ट कब करवाया? फरवरी का।
एक दिन आएंगे, थर्सडे को 2 बजे बाद आना पड़ेगा, कभी आओगे तो, है ना?
जी सर।
1 पे लिख दिया, ठीक है? अभी 14 दिन से थर्सडे तक, आज से दवाई शुरू करें, थर्सडे तक ये ब्लड टेस्ट कंप्लीट हो जाए।
लेके आ जाओ, मैं देख लेता हूँ कुछ दवाई।
2000 में हमने दिल्ली में किया था। अभी कैसे हो?
कब से है शुगर?
Eu de todos os alunos da gimnasia. Chamra ya, men zaza na taxa que chamra tem para que chamra. Mira mai ama muito sons de aí, cara, isso menos as pessoas que têm lá a
अभी करेंगे तो बीच में खाना है, पेट कम खाना है।
एकदम कम रखना है।